This is the Psychcast by MD Edge, the official podcast of MD Edge Psychiatry, where we bring you masterclass lectures and interviews with leaders in the field of psychiatry and psychology. I am the voice of MD Edge Podcasts, Nick Andrews. Welcome to episode 117 of the Psychcast by MD Edge. I am Nick Andrews and Dr. Norris. We look ahead to what we have in this episode. And between this episode and episode 116, it just appears to me that psychedelics and video games, as a psychiatrist, would you just prescribe getting high and playing video games? Dr. Norris.
Well, you know something?
No.
I think,
okay.
Yeah, I couldn't help but laugh. But it's interesting that people are using different things in which to deal with stress in their life. And actually one of the go-to things, for folks is something either to take their mind off of it, whether, I'm not prescribing that everyone smoke cannabis by any way, shape, or form, because we got better options out there. But what's the point you're getting at? We're looking at times for things that could either maybe entertain or distract us, or change our mental state. All right. So these are things that people are dealing with, and so we want to be able to talk about them. But no, I would not recommend that. But I would recommend some of the stuff that we've got here on the Psychcast over the past couple of weeks that people consider.
Yeah, of course. And last week, Dr. Fred Barrett at Johns Hopkins and psychedelics for different things that are being researched there at Johns Hopkins. And this week, we're discussing how video games could be used as some sort of therapy or treatment for children and young adolescents with autism spectrum disorder. And Dr. Norris, really fascinating idea. I think video games are under-researched in psychiatry, psychology, and in a bunch of other areas as well for training. A really interesting interview today. I really liked it a lot.
Yeah, I thought this is, in terms of Secret Agent Society, I thought this was a very, very, very great Psychcast that I want people to listen to, because it talks about video game technology utilized in ways in which you may not be familiar with. In terms of one, using the level system as a way of progression. Second, the way in which the game uses, if you will, snippets of people's emotional expressions to actually teach EQ or teach response, and then actually putting people through, if you will, scenarios. So I think that you're going to find in this Psychcast that this is really interesting in terms of how one to approach it, and just to give you another way to think about how we engage children ourselves, but particularly children who in autism spectrum disorder. That's where it first started, but it has since expanded. And I'm gonna tell you something, Nick. Recently, I was privileged. I was able to speak about the impact of the pandemic, if you will, in different states of disaster psychiatry and emotional responses to our internal medicine group here at GW Hospital. But this is what came up. What came up most was parents, how do they interact with their kids? That's what came up. That was the question that was being fielded constantly. So I think it's great that over the past couple of weeks here at MD Edge, we've had episodes that have really started to get at that child and adolescent psychiatry perspective, whether it's our current episode that we're going to be putting out now, whether it was the episode in terms of treating youth with anxiety on May 6th with Dr. Albano, and also the screening for suicide with Dr. King. That was on April 29th. So I think if you're out there, listeners, if you kind of want a quick toolbox, maybe in terms of our recent offerings in child and adolescent psychiatry, you got it there. You really got it. And you got it all sandwiched in. Nick was a master in like some psychedelics too, just to keep your mind a little bit like guessing a little bit. So I think we've got a really good show for folks. And I really hope that they listen to it, because it's a bit different and it's edgy, and that's what we're here to do.
Yeah, absolutely. So those are episodes 114, the Cassie Suicide Screening Tool with Dr. King, episode 114. Episode 115 was anxiety among young people, adolescents.
Yeah.
Our relationship with TED Med rages on later this summer. We'll have some more TED Med interviews, but coming up in a little bit, our interview with Dr. Renae Beaumont, Dr. Norris and Dr. Beaumont sit down and talk about video games for children with autism and how it interacts with the brain and what have you. But we also have some exciting announcements here on the Psychcast. So MDH has 3 podcasts that are going right now in 2020. Blood and Cancer is our official podcast of hematology oncology, hosted by Dr. David Henry, and Dermatology Weekly, which does a news segment and a peer-to-peer conversational segment. And we can announce now that sometime in the future, the SiteCast, MD Edge, Dermatology Weekly, and Blood and Cancer are going to link up in various ways, including Dr. Norris. You do a lot of work with the psychiatry of being diagnosed and going through cancer. So that conversation is coming up in a little bit, but just give us a little preview.
Yeah, I'm really looking forward to this conversation. I traditionally, in terms of when I first came to psychiatry, I cut my teeth, so to speak, in the world of psycho-oncology. I was the cancer survivorship champion for GW, GW Department of Psychiatry, hematology oncology, if you will. So I've learned so much from my work in hematology oncology. And so I'm really looking forward to this because we're embracing, if you will, true integrated perspective, not only in our SiteCast, but in medicine. So basically you need a team. So when MD Edge approached me and said, like, would you be willing to contribute to dermatology and hematology oncology? Absolutely. Sign me up. I'm a CL psychiatrist born and trained. So those SiteCasts are going to be dropping. And I encourage everyone to listen because this is, as far as I'm concerned, we're ahead. And this is how the format should be. We need to have multiple people from different disciplines contributing when necessary. So please make sure you listen to the Derm podcast because we're going to be talking a bit about something that we visited on MD Edge quite a bit, and that's physician mental health and physician suicide. So we've got some good stuff coming your way, and we've got it coming from multiple angles.
Yeah, absolutely. So just a look into what they've been doing. COVID has been a really big deal for both of those specialties as it has in psychiatry. Specifically, in my opinion, dermatology is one of the best specialties in all of medicine at telemedicine. So they've been covering that extensively. They've got great talks if you want to check it out. And Blood and Cancer has been really into this cardiac reaction with COVID, and the episode coming up this week with Blood and Cancer is all about coagulation and VTE. And if any of you are treating patients with COVID or lending a hand in your hospital, or if you're a trainee or a resident and trying to bone up, Blood and Cancer and Derm Weekly might be a good resource for you. And I've been pitching SiteCast to those listeners as well as a place to get all your mental health and wellness for in the time of COVID. Specifically, I believe it was episode 110 with Dr. Jacqueline Posada. But okay, I think we've been blabbering for too long. Let's talk about some video game. Let's talk about Madden and Grand Theft Auto or whatever, right? No? Oh, okay.
Well, actually, Nick, there are a couple things. I didn't want to go back to it.
Sure.
One, in terms of the thromboembolic nature of COVID, people, if I heard you, I haven't heard that SiteCast from our colleagues, hematology oncology. Everyone needs to listen to that. If they've been on that, people need to, as far as I'm concerned, everybody needs to be on that now in terms of the CNS manifestations of COVID. So we definitely want to talk about that. And now back to video games. Yes, Nick, we absolutely have got to play some video games or whatever. I think, you know what I'm going to do? I'm going to download. Like, I think there's like this golf game or this pool game, and I'm going to challenge you to it. And I'm going to play it on my iPhone, and then I'm going to talk trash if I beat you. But actually, you know what? I'm going to talk a little something, right? Did you watch the last two episodes?
I've watched episodes 8, 9, and 10. And episode 8 was the best episode of those 3, but I did. And just on a little side tangent, I think there's a lot to be learned in Michael Jordan in terms of his, like, do the means justify the ends? In sports, perhaps, yes. Was that leadership, or is it, revisionist history say, oh, I was just doing that to motivate my team?
You raised some good questions. Two things stuck out to me in the last episodes, which is a number of things. But one, the relationship that he had with Gus, his security officers. I should say 3 things. Gus, the head security officer. Second, how essentially, and maybe I assume that the directors did a great job of this. I really felt that he was trapped by his own fame.
Sure.
At the end. I just had that impression, like this little set group of people was his. And then the other thing, which you were saying in regards of does the end justify the means? I was looking at the reaction of the response of his teammates after they won Game 7 and beat the Indiana Pacers. And it was kind of like they weren't sure what to do. They were kind of like, are you happy with us? Or are you what? It was the odd. I mean, I was just struck by the response. So I think you nailed that right on the head, man.
Yeah, absolutely. I think for everybody in the fields of psychiatry and psychology, the MJ documentary series is not a bad one to kind of get inside the competitive psyche. But okay, so let's, we've been talking for quite a while now, and we hope you're still with us. We do have this conversation with Dr. Norris and Dr. Beaumont coming up right after this. Dr. Norris, thanks for chit-chatting with me. We look forward to your crossover podcast with dermatology and hem-onc, and I'm so glad we got to talk a little basketball as well.
Absolutely. Always, Nick. Always, man. Be safe out there, man.
You too. Take care.
Bye now.
My name is Dr. Renae Beaumont. I'm an assistant professor of clinical psychology at Weill Cornell Medical Center, New York Presbyterian Hospital, and the creator of the Secret Agent Society, which is a video gaming-based therapy program for kids with social emotional challenges.
Hello, this is Dr. Lorenzo Norris, Editor-in-Chief of MD Edge Psychiatry. Today we're privileged to have Dr. Renae Beaumont with us today to talk about a very innovative approach that she has created to working with children who are dealing with emotional issues. It's called the Secret Agent Society, and it is a video game program that Dr. Beaumont is going to speak with us about. And given the particular challenges that most of us are facing in the midst of the COVID-19 crisis, I certainly think that Dr. Beaumont's Psychcast is going to be a very timely one that a lot of people can take some points away from. So, Dr. Beaumont, please, welcome to the Psychcast.
Thanks so much, Dr. Norris.
So, Dr. Beaumont, one, I would like for you to tell us a little bit about the Secret Agent Society, and I can tell you firsthand, I am absolutely ready to hear about this. Probably many listeners, absolutely ready to hear about this. Many listeners in the audience, I was just talking with a colleague of mine right now, are having the experience of homeschooling their children or being with their children in ways that they never really were before, and your home environment turning into something that you weren't expecting it. And I really want to hear from you in terms of this, what the Secret Agent Society is, how it was developed, and what your goals have been for it. So please go right ahead, Dr. Beaumont.
Wonderful. So the Secret Agent Society is a video gaming-based program that teaches kids the skills they need to feel happier, calmer, and braver, and to make and keep friends. And certainly in challenging times like now, there's a lot of kids out there who are really scared, afraid, unsure, as well as parents and other members of our community. So I think this really shines a light on the importance of mental health and resilience, and all of us having the coping tools we need to be able to stay calm and face challenges as they come our way. Now, the program I originally developed for children on the autism spectrum. So I was actually working as a flute teacher before I became a clinical child psychologist, and I was working with this young boy who was incredibly proficient technically, but struggled a lot with expressing emotion through music. And when I spoke to his mum, she kind of said, hey, he has this condition called what was previously called Asperger's syndrome, now autism spectrum disorder. And I really got an insight into the struggles that this family and this child faced in terms of being able to navigate the social world around him. And whilst he was incredibly bright intellectually, getting great grades at school, he didn't really have any friends. He was the kid who wasn't invited to birthday parties. And so I in terms of that development journey, I was like, I really want to help this kid because his social difficulties are really going to get in the way of his ability to achieve his potential in life. Now, he, like many kids on the autism spectrum, loves technology. So I was thinking, hey, wouldn't it be cool to create a computer game to try and teach these social skills or social rules that for a lot of us are just innate, that they just kind of develop. We don't really think about how we talk to people or how we hang out with people. But for many kids on the autism spectrum and kids with some other challenges as well, it's almost like they have to learn these skills like a second language. So the goal of this game is really teaching kids in a fun, interactive, engaging way, hey, this is how you can detect how someone's feeling from facial expression, voice tone, or body posture clues. This is how you can kind of notice the early warning signs that maybe you're getting really angry or frustrated or anxious. And here's some strategies you can use to kind of calm down in those situations. And also the skills you need to kind of thrive socially. So how do you talk and hang out with other people? What do you do if someone starts teasing you? So these skills are very important for lots of kids, not just those who are on the autism spectrum or maybe have more diagnosed mental health conditions.
I agree with you completely. You started off by describing to us at first the original reason why you developed the game, or the impetus of it, in terms of working with one of your patients with autism spectrum disorder. But as you were describing it, and again, speaking from my own personal experience, some of the listeners already know, I mean, I have two daughters. One is 13 years old, one just turned 11. And many of the things that you talked about, I actually am talking with my daughters on a daily basis in terms of navigating, to be perfectly frank with you, the rigorous environment of middle school and getting ready for high school. And I do mean rigorous. I mean very intense. When you said recognizing social cues, how to fit in, what's a conversation, who's popular, who's not. I mean, we could just do a whole psychcast based off of that. So all of that, even if you, and it's interesting that you talked about these things are innate to us. But with that being said, I also think about you learn how to speak innately, but that's very different than when you actually take an English class or old school phonics class back. I'm dating myself a little bit. Yeah. Like, remember when you have to actually write when you have to diagram a sentence? And kids don't even know about that anymore. But when you actually study a thing, then you're like, oh, wow, I didn't actually know that's how language worked, even though I was using it. So when you were talking about it, I was like, oh, yeah, this is good. This will benefit. And by the way, hint, hint, it will actually benefit many of us adults also in terms of our communication strategy. No, it absolutely will, because, one, we can always learn. Now, can you describe a little bit about what the Secret Agent Society does, or what it is? Because, I mean, you might have some clinicians out there, they're like, what is it? Is it a role-playing game? Is it a, multiverse online thing? Is it a first-person shooter? No, I'm sure. But, I mean, help them out, because they're having all these experiences, and they're like, I don't Secret Agent Society. What is that? What is that? Explain it to them. Yeah.
For sure. So the video game has 4 levels and a range of different activities. Okay. So level 1 really teaches the kids about, look, how do you detect how someone else is feeling from facial expression, voice tone, and body posture clues. Okay. So a couple of the facial expression games, for example, they have to create a face from different components on the screen to illustrate a target emotion. Then there's a game that's kind of like a memory card game where they have to try and find a card that matches the target face or emotion. We have, a special voice verification game where they listen to secret messages that are said in different voice tones, male and female voices of different ages, different nationalities in terms of accents. I mean, you can probably notice I'm Australian from mine. And then they have to detect how the person feels from how high or low the voice is, whether it inflects up or goes down. We also have one where they watch little vignettes where the faces are blurred out, and they have to detect from body posture or movement how a target suspect feels. So level 1's really that emotion detection through watching real pictures or real animations, real video clips of vignettes, and being able to decipher those social cues. Level 2 of the game sort of builds on that in terms of thinking about recognizing emotions within ourselves. So one of the activities in level 2, there's a series, we call it the Detective Laboratory. And this is a series of scales where they have to calibrate the scales to show how fast your heart beats, for example, when you feel anxious or angry. Your breathing rate. There's a thought catcher game where you have to actually click on the thoughts that match the target emotion, so understanding that link between thoughts and feelings. And then they calibrate their own scales showing the body clues that signal low, medium, and high levels of sadness, anxiety, anger, whatever the target emotion may be for themselves, and they can print those scales out as visual reminders that they can use in different environments, at home and at school, so they can be on the lookout, on high alert for early warning signs that they're starting to get anxious or angry, because that's when relaxation strategies are most powerful. Once you're like 8 out of 10 and having a complete meltdown, it's really hard to pull it back. And I think as adults we can relate to that as well.
Absolutely.
So then in level 3, it's like, okay, so you're recognizing how others feel, you're recognizing how you feel. What do you do with that? How do you know how to calm down appropriately? How do you know what the appropriate social behavior is in different social challenges? So it's kind of like the old school choose your own adventure style storybook.
Yes, I remember those, yes.
It's like that, but in kind of animated vignettes. And so the child has an avatar character that has to navigate through these different vignettes or scenarios. And those vignettes kind of capture the sorts of social challenges a lot of kids face on a day-to-day basis. So it might be things like, trying a new game or activity, or losing at a game or activity, having to do group work in class with other kids who maybe you don't like their ideas, you think your ideas are better. How do you navigate that in a way where you're not annoying and they think you're taking over? How do you tell the difference between friendly joking and mean teasing, and how do you respond to that appropriately? So these different vignettes, the child chooses how their avatar, first of all, the avatar has to detect how they're feeling and other characters are feeling at certain key points. Then they have to decide how their avatar is going to cope with that emotion, like if there's a detective flying competition. And they have to decide, is their avatar just going to take off and start because they're super excited, or are they just going to take a moment, take a slow breath to calm down first? So then they see the different outcome for their avatar in terms of how they perform in this flying competition, and then decide how will their avatar cope if they perform well. Are they going to brag and tell everyone how awesome they are? Or are they going to be more humble and congratulate others? And if their avatar performs poorly, they're going to get really upset and start blaming everyone else and have a big temper tantrum, or are they actually going to calm down and move on with what they need to do? So that gives you a bit of a feel of the different skills that are taught in the different levels. Okay. The other key component, which I think speaks to an important point that parents should keep in mind when their kids are playing, educational video games, for example, is that the research we've done shows that it's all great to be playing the video game and ideally doing it maybe with a parent or school staff member with them, so they're learning at the same time, like you said. But it's also very important for the kids to be putting those skills into action in their daily life. So we have a secret agent journal section in the video game where the kids are given missions of how they need to apply these skills in their daily life, and they can create pictures using a scene-generated device to show how they use the skills. So that example of detecting how people feel, they're then prompted to go and do that in their daily lives and kind of capture evidence on, hey, I noticed my teacher was really angry at me when I was talking in class because their voice was raised, they were frowning, they were staring. So it's just about helping with that skill application to daily life.
I really like how you've got it set up, including the 4 levels, because any of you that are gamers out there, people, we like levels. I like how it's built in terms of you start with the emotion detection, then you move to in terms of self-awareness, and then, your skills and what's required increases until you get into much more, if you will, higher level or nuanced things and decisions and things of that nature. So that is all excellent. And I really, again, as someone who has played, I'm a child of the 70s and 80s, so Atari, ColecoVision, all of that stuff. I drink all the Kool-Aid, Legend of Zelda, you name it, all of it. So going back to all of that, so that speaks. Now, with that being said, a lot of folks sometimes gaming or video games, they get a bad reputation. They get, people, you think of a video game and you just, depending on who you are, also if you're in academics, you're just kind of like, what is this? You just see brain cells deteriorating. But how might we start to think about video games, particularly educational games, maybe in a different venue?
That's such a great point you make. I think one of the first things to try and help parents navigate this, because it's hard, right? You see your kids having fun, they're really into something, you want to support that, but then you're like, is this doing the good or is it doing more harm than good? So I think the first thing is kind of what the kids are playing, right? Like you said, if they're playing a lot of the first first-person shooter game.
Right.
And that's in a home environment where there's a lot of conflict, a lot of loving interactions. They're seeing maybe violence or aggression in other contexts in their life. Then maybe it is putting them at risk of potentially being more violent or aggressive. But if they're playing games that are teaching them skills, that have educational content that involve connecting with others socially in a positive way, whether that be family members, friends, and particularly, as I said, looking to the research around does this work? Whatever a game, if it is an educational game and they're claiming a certain outcome, well, what's the research they've done to actually back that up? Because I think there's an explosion now of all these educational games or serious games that make claims around, boosting cognitive performance or boosting, in my case, it's social skills. And so you've got to really do a bit of a deep dive into, well, what's the evidence? What's the research? And who's it been done with? Has it been done with people similar to my child?
Right.
In which case we can feel more confident that, okay, this may be valuable and beneficial. This is something I can encourage, support. And the other key point for parents is do the co-viewing thing. So by that I mean, set a precedent from when your kids are fairly young that you're going to sit and play with them in terms of, play a video game or watching something online. That the expectation when they're young is, okay, I'm going to be there helping you out with what's going on with your online communications. And when we're confident that you've got this in terms of staying safe and knowing how to respond and not posting anything that might be detrimental, then of course you can kind of loosen those reins and let the child take on more independence and responsibility online. But setting the expectation from a young age around we're going to watch this together, we're going to play this online game together, in terms of engaging online, and when social media starts to come on board, that's something we're going to navigate together to help set you up for success and make sure you're safe.
Okay, I agree with all of that, particularly in regards to what's out there and looking at the evidence basis. We're talking about the Secret Agent Society. Some of the things that I think about from my own experience, and I feel what I'm hearing in terms of one of the strengths of the Secret Agent Society is this really using real pictures and working with kids to recognize emotions that are presented as well as their own, and then nuance things. And why is that so powerful right now? I want every parent in here to think about it, depending on the age range of your kids or whatnot. Don't think our generation. Think their generation. And I guarantee you, probably at minimum 60 to 75% of them, they're doing something with their phones that none of us ever did. It's called FaceTime. They are all FaceTiming, every single one of them. And I would bet you, if you talk to most adults like myself, I mean, we're a little bit reluctant to FaceTime. We're like, oh my, how intrusive, why would I FaceTime? I mean, just talk on a phone, that just seems so personal. Whereas if you talk with, if you will, like someone like my daughter, Taylor's like, how could you not FaceTime? What is wrong with you? Are you like, she says like, you're from that other century. How could you even? That's awful. So audience, work with me here. If we have a game that not only is it simulating emotions, it's simulating emotions how a number of our youth are actually going to encounter them now. And not just in person, but it's simulating emotions in ways in which they are going to encounter them. And I would argue, now for some of us, and I can speak for this, I normally hate talking over the phone or at a distance if it's something important, because I feel like I lose 80% of the message. So consequently, you have to build your skill set up to where you can interpret these messages in this medium, all right, which is, so I think that's a big advantage of the Secret Agent Society, that is teaching our kids something. And also, if you do it co-viewing, I'll get to that in a moment, like in the right here and the right now. The other thing I would say, in terms of video games, is that, trust me, I've seen my fair share of shooters, role-playing games, all of this stuff, Super Mario, Smash Bros. I can just go through them. But here's the interesting thing about Secret Agent Society that I think I would challenge parents in the audience as well as other folks. Your child, the child may immediately gravitate towards it, or they may shy away from it. But I guarantee you, if it's anything like my house, what's going to happen? You're going to put on whatever the new wave video game is, and then they're going to play it for a week, and then they're going to get bored, and they're going to ask about something else, and they're going to be like, and you're like, hey, why don't we try this? And, why don't you tell me what you think of this? And if you're really good, you can actually link it with, because what I'm thinking about with the Secret Agent Society is right now, my daughter's playing Jedi Fallen Order or whatever, and we've had a lot of long discussions about the Force. Like, what does the Force mean?
Yes.
What is the Force? But basically, the Force is just basically another way, if you hear, but it's how they use their emotions. Let's actually talk about real emotions. In the Secret Agent Society, what we're trying to do, 3 particular things: happier, internal, calmer, how you interact with the environment, as well as braver. How do you actually confront situations of conflict or stress or ambiguity in which you may not feel comfortable with. So if we learn those 3 things, then we're going to be all right. And then my other point before I hand over to Dr. Beaumont, I want to say it's, all right, sometimes, you think you know something or whatnot, so you try to teach it to somebody or whatnot. And then, again, they may say that they don't know it or whatnot. And then you try to teach it again, and then you're like, God, what's going on? And then finally they repeat it back to you or whatever, and then you're like, wait a minute, now I finally know it, or I realize what I didn't know. So I would challenge, again, clinicians as well as parents, go out of your comfort zone and think about this, because it's going to force you to think about it in a different way in which you initially trained or learned about emotions. It's going to be similar but different. So please, Dr. Beaumont, let's talk a little bit now in regards to, in particular, Secret Agent Society and the program in terms of what it can do. And now let's make it a little bit more in terms of if we're a clinician working with a child that we feel as though Secret Agent Society might be indicated for. Please go for it.
Yeah, I think, I obviously train and supervise a lot of clinicians working at Weill Cornell. And one of the challenges I often hear clinicians say is, how do I engage kids? Like, you want kids to be coming to session excited. You want them to want to learn about this stuff, not be rolling their eyes and sighing when they come about, like, do I really have to do this? And so the feedback that I certainly get from a lot of clinicians who are using this software, and we have a range of other sort of physical games and activities, like spy-themed board game, we have a walkie-talkie game, so there's some additional activities that clinicians can use in conjunction with the video game in session, and also get kids to maybe play the video game between session. And the key thing is it makes sessions really fun, really engaging. I mean, when we run multiple Secret Agent, we run it in group format, we run it individually, but the feedback we often get from kids, which is, I think, a wonderful strength, is, hey, the biggest issue was we wanted it to go for longer. We wanted to keep coming more. And I'm like, that's amazing. Like, for you to be engaged and excited about learning about your feelings, other people's feelings, the social world around you, and how to navigate that successfully, that's a huge win for clinicians.
That absolutely is. Now, Dr. Beaumont, I'm going to ask you a few things in terms of, along those themes. In terms of clinicians, is there a particular subset or population of children that you would say that this is most indicated for?
Absolutely. So generally the research is strongest for 8 to 12-year-olds. We have shown effectiveness with kids as young as sort of 7, as old as 14, but the sweet spot in terms of developmental fit is 8 to 12. So as I mentioned earlier in the call, kids on the autism spectrum, but with sort of intellectual functioning sort of at least within average range, is who the program was originally developed for. But really exciting, some of our latest research has shown the program is as effective for kids who have anxiety disorders like social anxiety, and or those who have ADHD, as what it is for kids on the autism spectrum. So for a kid with social anxiety, they may be interpreting everything around them as a threat cue, as a sign that people don't like them, people don't want to be around them, people think they're boring or stupid. So it helps shift that focus and interpretation to a more positive one and boost their confidence socially. And then for kids with, sorry, you were going to say?
Right. So it seems in regards to indications, we have 8 to 12-year-olds initially works in terms of the evidence base with autism spectrum. There is an expanding literature in regards to social anxiety, ADHD, and other disorders, but that's an expanding literature where the evidence base isn't as robust for the autism spectrum patients. Now, with that being said, are there any things, Dr. Beaumont, where you'd say, no, I don't want to use in this? This is a contraindication to using Secret Agent Society with this group of patients.
That's a great question. I mean, the one time where I felt, this isn't quite the right fit is when parents come to me and say, I can't control my kid. I don't know what to do. So in that case, I kind of be like, well, maybe we might start with some parent skills training, so boosting the parents' confidence and competence before we start working in the space of kind of helping the child with self-regulating their own emotions. So I sometimes feel there's still a role for it, but maybe not as the first step in those cases.
Okay. That goes back to what you just said there. There has to be a certain baseline level of intellectual functioning, as well as, in addition, we always say safety first. There has to be something in the environment to where the child can regulate themselves. Particularly, I'm thinking about maybe the child gets frustrated, or because that's the flip side of games, which I've definitely seen. If someone gets frustrated, if they can't do what the game is saying, then that could be a real bad look. Now, so we've gone over some indications, we've gone over some contraindications. We've gone over the population. Now, in terms of clinician training, can the clinicians just recommend this, or do you recommend that they play it first, or do they need to do anything special outside of their typical either whether they're a psychologist, psychiatrist, licensed case social worker, a nurse practitioner? Do they need to do anything out of their standard wheelhouse? And by this, I'm assuming clinicians that have been trained in some form of psychotherapy, all right, not just pure psychopharmacologists.
Yeah, so we have a few options available. I mean, the computer game, the Secret Agent Society, what we call Challenger board game, clinicians may want to either have a sneak peek at the computer game trailer. It's the Social Skills Training Institute is the organization that publishes this. They can Google it, look it up online, have a little sneak peek look at the trailer. So they may want to just integrate the computer game and board game into what they're already doing in their clinical services. Another option, though, is if they want to be using like the gold standard evidence-based protocol or program, we do offer training both face-to-face or online through the Social Skills Training Institute to professionals globally in how to deliver that sort of session by session, typically in a group format, but as an individual delivery option as well, how to do that in a way that's really going to optimize therapeutic gain, particularly for those complex clinical populations where you've got kids maybe with multiple diagnoses, where they haven't had great success maybe to previous treatments that they've tried. So that's sort of a more intensive therapeutic offering that does require clinician training.
Yeah, just listen to you. I mean, I probably myself, I would opt for the formal training, particularly if I'm dealing with any type of complex patient. By complex, I mean a patient that has multiple comorbidities, whether quote-unquote psychiatric or medical. And I would also, I think that the other option in terms of just kind of more the, if you will, less intense option may be best suited for you want to try it and you're adding Secret Agent Society to an already stable treatment regimen, so to speak, in terms of your psychotherapy and psychopharmacological offerings. So with that being said, Dr. Beaumont, please, in regards to the Secret Agent Society in general, but also specifically, but also in terms of educational gaming programs, it would be remiss for us not to speak of the COVID-19 pandemic. It would be remiss of us not to mention, I don't know when the Psychcast is going to air, but of our colleagues in New York, New York State and New York City. Many listeners of the program know that I am an alumni of Mount Sinai Psychiatric Residency Program, and New York City is being absolutely and completely hammered, and my thoughts, heart, prayers go out to all health professionals, EMTs, psychologists, psychiatrists, you name it, nurses, social workers, people at grocery stores at this point in time, because I would maybe loop them in too. Everybody who is just working nonstop to battle this pandemic. But in that context, Dr. Beaumont, can you give us some thoughts in regards to, again, educational gaming in general, and how maybe we can start to think about this in the context of a pandemic in which we are all, for the better part, on either self-quarantine or lockdown, and we're facing things that we have never even conceived of in this country, and I would also dare say that the last generation who could have really guided us through this, which was the greatest generation, many of them have already gone, if not most of them. So please, Dr. Beaumont, go ahead.
Yeah, I think, a lot of the children and teenagers I work with, just like most of us, are incredibly scared and frightened right now. Most of us, I would say, have ever experienced anything remotely like this in our lives. And the power of educational gaming, therapeutic, serious gaming, whatever you want to call it, I think we all need a reminder of, hey, let's focus on what we can control and how to cope with what we can't. So, the recommendations around hand washing, social distancing, all those things can be presented in a really engaging way that connects with kids through something like serious gaming, therapeutic gaming, and then also teaching them, and also, as I said, the importance of co-viewing, why parents, everyone watching this, not just kids, but all of us, parents want to be a good role model in how to cope in times like this as well. So also watching or playing a game that kind of gives some tips and strategies around coping skills. So, it may be, how about we do some mindfulness or meditation with an app at the beginning and end of each day, every member of the family, to just reset, be in the calmest space we can to face the day ahead or to go to sleep, the importance of regularity and routine as much as you can in times like this. I think that information can be communicated in an engaging way that delivers the message without scaring kids more than what is needed through education or serious gaming. So there's such power. The other thing is, at times like this, we can't, in most cases, deliver face-to-face services to patients.
Correct.
I mean, we're doing Zoom, but the power of being able to deliver that message in an engaging way, in a broad way that has optimal reach and impact. We're not just working one-on-one with individual kids or families who put up their hand and say, hey, we need help. Most people at the moment are struggling in some way and feel great levels of anxiety. So to be able to reach these people in an engaging way that doesn't heighten their anxiety further, which excess, exposure to social media can do that. So doing that in a constructive, focusing on, coping well through a therapeutic game, I think has such incredible potential in times like this.
Okay. Dr. Beaumont, I couldn't agree with you more. And to our listeners out there, I think Dr. Beaumont has given us an excellent example of how, even within the current context, how we can adapt and live our life in different ways to still stay connected. Dr. Beaumont, talk to us about the Secret Agent Society and how it walks us through in terms of, basically, if shorthand, in terms of increasing our emotional awareness and emotional intelligence. And I think it's certainly applicable for many folks, even though it's developed in terms for the autistic population. I think it has applicability for all of us. And I really am going to go back to three of the words that Dr. Beaumont said before: happy, calmer, and braver. And all of you out there, I mean, whether you're everyone is social distancing, but you're getting out for exercise, you're walking with your families. Think about if you have worked with your child or someone and you recognize your own emotions, and you are, more importantly, able to project a sense of calm, bravery, and internal happiness to everybody that you see, whether you're 6 feet apart or not. So there's been a lot of talk about herd immunity in this country, and I agree with it. But make no mistake, herd immunity starts, the backbone of that is hope. And how we communicate that to each and every one. And make no mistake about it, emotions are contagious. So if we are all doing that, we're all going to remain calm, we're all going to stay focused, and we're all going to be able to deal with the events that are going to come. We're going to be tested, but programs like this, as well as the work of many others, are going to give us unique and innovative tools to deal with it. So, Dr. Beaumont, I want to thank you so very much for taking this time out to speak with us, and I hope you guys continue to battle this pandemic at your institution. Okay?
Thanks so much, Dr. Norris. Yep. Take care, everyone.
Okay.
Hold
on. All right,
second.
I think we're good. Okay.